Hi, I'm Dr. Yolanda Cintron at the International Center for Dental Excellence, a biological dentist for 27 years.
I'm Dr. Yahki Awakened. I am basically a human biologist and a science nutritionalist. So that's me. I'm glad to be here. As you can see, I'm here and she's getting me fixed all up. But I mean, look, hands down, the best natural biological dentist I've ever met in my life and taught me so much. She don't even know how much she taught me, to be honest with y'all.
So I am so honored to have Dr. Elohim here because he's helping so many people. And our passion together is to have information go viral because we have a heart for the young people, right? And then the young people are full of plastics. They're having all these neurological problems. And do you know that if a woman has mercury fillings when they're pregnant or their grandmother had mercury fillings, what happens is that when they have a baby or the man has mercury fillings, through the sperm, it goes to the fetus. So there's people like I've been born with neurological problems like anxiety and depression that is from the parents.
So the parents actually pass on their actual
City. Exactly. So, that's something that really we have a lot of young people that are coming that are suicidal. And then the parents are bringing them in because they want for me to check their mouth. So these are the things that I'm finding. Either they have mercury fillings themselves, their parents had mercury filling, but now they're putting plastic fillings, which are like increases estrogen in the body.
Yeah, because the body cannot tell the difference between estrogen and microplastics at all. It looks at it like it's the same.
Imagine that.
I got a question. When they come in, I'm pretty sure they're going through some type of psychosis, right?
Yeah.
From the mercury toxicity.
Yes.
Once you remove the mercury fillings and then you go the correct way to restoring the mouth, just a time frame, how long do you think it takes for them to start having a psychosis breakthrough, where they start feeling better again?
Yeah. Yeah, that's a great question. Our experience is how suicidal are they? So we do the removal of the mercury very cautiously or the removal of the plastics very cautiously. And then we work with the doctors that are referring the patient to see what would be the route of detoxification. So why don't you share your experience and what you do in your clinic?
So when any patient that comes to my clinic, the first thing we do is we always do live and dry blood analysis. We do biological scanning where they come in and they stand on our STICU scanner. We scan them to see their fat deposits on their organs and stuff like that. That way we can get a risk assessment of how close or how far they is from a typical disease.
Okay.
And then we check their mouth. So we have this little scanner. It's like a stick this long. They got a camera at the end. You put some plastic over it. And we check their mouth and take pictures of their teeth. And then we have this scanner that gives this fluorescent light to turn the lights off. And you make them stick out their tongue and you put this fluorescent light on it. And it can show types of bacteria, lesions, any type of cancer, anything that's in the mouth. Once we do that, if their mouth is bad, I won't even take them through the rest of the steps. I tell them that they need to come see you. Because there's no point in them spending extra money when I know for a fact their root cause is the issue in their mouth, and they can come see you, and that'll take away all the issues.
So you just saw a patient that you referred to me.
Yes.
Was that in alignment with what you saw?
So that's the exact same thing happened. He came to the clinic with his issues. I took him through my steps, and then once we took him inside of the iridology room, we did an iridology reading on his irises, and then we checked his teeth. I said, we can take you to do therapies and we can take you through the next individual steps, but I'm not here to take your money. I think you need to go see the dentist, a biological dentist, one of the best doctors that I know in Fort Lauderdale.
And he drove all the way for 5 hours.
Because he didn't understand how bad his mouth was until I told him. And you can see the look on the nurses' faces when we was checking him. He was like, Doc, what's going on? I'm like, look, I think your problem is not what you think it is. I think it's your mouth. But I'm not a dentist. And I can only go so far with these pictures.
Right. But what you're doing is so magnificent. I just came from a medical conference and these are concierge doctors, with a lot of concierge people, and they never spoke about the infection on the mouth affecting the heart. And they're like, the number one killer for The world in the United States, everybody's dying from heart disease. But nobody spoke about, you saw what you saw. Okay. So a patient like has infection on the mouth, that infection goes to the heart. They end up with endocarditis, bacteremia, pericarditis, lung infection, COPD, strokes. None of them spoke about that. Like it was not even mentioned.
And the study shows when you start looking at these clinical studies, whether they veto studies, they cohort studies, they are pulling out hearts from people that die and they're checking the bacteria. And these bacteria
Who's the bacteria?
associated from the mouth. So so obviously these meridian pathways exist.
They exist and the cardiologists know about it.
Yeah.
But I went in research. I'm like on a mission. There's got to be a cardiologist. John Hopkins, Mayo Clinic. I'm looking at all the podcasts from the cardiologists. I'm like, there's got to be somebody that's talking about that. Zero.
Well, I'm glad that you are, and I'm glad that people are looking to you for training. You're doing an amazing job, but you're obviously my clients are coming here and turning their whole lives around. So I just think it need to be more people in your job and position working with more doctors, more physicians. And I know that you're willing to. I just think that the physicians need to open their minds up more. But it's a closed system when it comes to education.
Yeah. And it was interesting because I asked some questions and then
I got one question I got to ask.
Oh yeah. Okay.
Thanks.
You can say. So after I was asking a question to one of the prominent doctors that and then I said, I'm so grateful that, he has created this blood work that it would be $15,000 for the patient to go through that. And he's making it, accessible and affordable for average people. I think it's very important because I said, I like to see all those A1C, right? And then we want to know the C-reactive protein, the levels. I have patients that have A1C of 14. When it's supposed to be 5, they're going to die. So, and then C-reactive protein and a prostate patient of 171. I've never seen anything like that. So he had a high A1C, a high C-reactive protein. He came from Trinidad. He said, I got prostate cancer. I'm going to die. They told me I'm going to die. I look at the results. I'm like, let's clean you up. We got all the leukemia out, all the infection out. You can see on the photos. I'll show you his photos. From us cleaning him up to the next visit, he's like another person. So tell me what you do for prostate cancer.
So what you would do is somebody come in with prostate cancer, because I'm a non-physician, even though I'm a doctor, because I got a doctorate, I'm a non-physician. But if they come to our medicinalist clinic and they got prostate cancer, let's just say their prostate-specific antigen number was 3.
Okay.
If I know that the prostate is inflamed, I know they have malignancy there. The first thing I'm gonna do is check their mouth. And if their mouth is messed up, of course, I'm going to send them to you. But let's say if they don't have any dental issues, which I've never seen anybody with cancer that didn't have a dental issue,
Right.
just to put it out there. But let's just say it's something minute and it's like not a very systemic infection.
Yeah.
I'm going to go after oxygen. Obviously, they hypoxic and they're in an environment where oxygen is not being converted over to water to make ATP. I'm going to offer them hyperbaric oxygen chamber therapy.
How many sessions?
For somebody with a PSA of 3, I'm offering at least 20. I'm going to do 20.
Wow. I have seen people here with PSAs of like 73. Imagine that.
And then what I noticed to be super effective, though, is negative charge magnetic therapy. So the negative side of magnetic therapy is very, very anti-inflammatory. And what you'll do is you'll take the magnet and you'll put the negative side on your body. So I will make a magnetic pillow for him, and I have him sit on it as much as he can throughout the day. And I will give him acoustic lymphatic massage of the lower half, where I massage his lower extremities for about 40 minutes every single day. Also do a vibration plate.
Wow.
Just to increase
Like a power plate?
Yeah, a power plate.
So you're like trying to bring things down.
Yes, trying to bring things out. To shake up the lymphatic system, you got the T cells, the B cells, the macrophages, just to really get that immune system going to go after any type of pathologies that's there and to increase circulation, because we already know that the blood is what feeds the cells the goodie. And if you got poor circulation, then how are all of those goodies going to get to that prostate? And I would just give them a bunch of oxygen. And I noticed this too. Copper deficiency always play a role in cancer. Copper and magnesium.
So you're doing the minerals and you see that
IV therapy, intravenous IV
Yeah.
therapy, high dose vitamin C,
Awesome.
all of that. You're gonna have to.
Yeah. So I have a question. So some men, like we have patients that have prostate cancer, and all of them have infection on the teeth that are connected to the prostate meridian.
Yeah.
And it's so simple to fix that, So it's like the front teeth are the ones that are connected to the prostate meridian. So sometimes people have had an accident, the teeth are dying, or the gums are really infected, like you saw that.
Yes.
I know his prostate is.
Amazing.
Yeah, you saw that?
He a new person.
Yeah, I know person.
I
The next day, he told us, he said, you give me your life back. It was like so rewarding because, didn't know us. It took a lot of faith for them to come, drive 5 hours.
More than that.
They were scared.
Tennessee.
Yeah.
They were scared.
No, I let him know. When I seen him
Yeah.
and I seen his mouth, I said, look, I don't know how serious you think this is, but however serious you think it is, it took you to get to me. It's 100 times more serious for you to get to her. I said, you need to go see her immediately. So I'm glad he came. He looked totally different now. His mouth looked amazing. Y'all did an amazing job.
So it's really rewarding to us, that we can see the changes. And we have 12,000 patients. I have been here for 27 years, but we do biopsies on the teeth that we pull. So that way we have a microbiology report, because sometimes, the doctors and the patients, they don't know what they're dealing with. So what we find is a lot of parasites. And, parasites are linked to cancer.
I've never seen one cancer patient that didn't have a parasite, nor, like I said, some type of dental infection.
Yes.
When we get people that come into the clinic, I like to do live and dry blood analysis on them, and every last one of them have some type of protein inside of the blood.
So I want you to share, where's your clinic? Where do we got to fly to? James and I are going to fly because I want to see my light blood. I want to see my blood.
We got cold plunging, we got infrared sauna, we have infrared light therapy, what I call mitochondrial repair, because that's exactly what it does. We have post electrical magnetic therapy, we have magnetic beds, lymphatic therapy, acoustic lymphatic therapy, magnetic therapy. We got colonic bed, and
I love you.
It's amazing.
Those are all the things that I like to do. We are committed to helping people. Prevention is the best medicine.
Yes, it is.
So when we have patients coming here, we fix them. We don't want them to be dependent on us. Brushing, flossing, cleaning your tongue, water picking, taking prebiotics and probiotics, and getting your gut biofilm.
Yes.
That's really important. Really. So what are your recommendations for that?
Just for the gut biofilm to rebuild that, probiotics, fermented foods, definitely fermented foods.
Like, what would that mean to a regular person? No.
So fermented foods are just foods that are fermented. That's the same thing when you eat and once the food gets inside of your stomach, it goes to the stomach. The hydrochloric acid, of course, breaks it down. It goes into this 9-inch intestinal tract called the duodenum, what they call the duodenum. And you have trillions of bacteria there that helps you break down that food. That process is called fermentation. So that fermentation slowly releases the sugar into the bloodstream, and that's how you get all of your nutrients. But the good thing about that is that actually culturalizes more bacteria, and these bacteria can be good or bad, but most of them are good for you. And these are things like lactose bacillus, bifidum bacteria, and all these bacteria, they help you break down your food. They help you with your mineral absorption. They help you convert over your amino acids and break them down through sugars through something called glycose aminoglycans. So bacteria is amazing when
they are our friends.
Yes.
They're not
or enemies.
They're not enemies.
Unless it's who's a bacteria.
And to be honest with you, a lot of parasites, the more and more I research, are not really your enemies. These are just bacteria that pleomorph themselves to become bigger to help eat on necrotic tissues and to help you. They're your trash cans. If you got a bunch of accumulated toxins that the microbes can't get to, then they can pleomorph and grow into these parasites, and these parasites will help feast and break them down too. It's just that every time you see something, if a robbery happened and a person is around every robbery, you're going to start saying that's the robber. But what happened if that person is really the superhero trying to keep you from breaking into stuff?
Right,
And that's what's
right.
going on in society.
So really,
Mhm.
you know, it makes me think about a patient who
Mhm.
came here with COPD, 8 root canals.
Wow.
She's like, I'm not taking 8 teeth out. She got worse and worse. Came back 2 years after. Now she's like, can barely move.
Yeah.
We did biopsy on the teeth. Klepsopneumonia
Yeah.
on the teeth. COPD.
Yeah. That makes sense.
Makes sense with your theory right here.
Yeah. Makes sense.
So the infection from the root canals went into the lungs and gave her COPD.
Wow.
We cleaned that up. I told her 40 sessions of hyperbaric. Her doctor was like, this is the most remarkable reversal based only that she couldn't do anything else but hyperbaric.
Started in the mouth. So, I mean,
Yeah.
the root cause really be in the roots of those teeth. And that's what I'm truly, truly learning with everybody that's coming in. You do a good job at documenting everything. I'm not as good as you as documents, but I'm all there. But all of the documents we see, it's showing us the same exact thing. That it's the mouth. It's the mouth. It's the mouth. And if you can preventive maintenance, keep your mouth hygiene up, then you
That
won't
would
even
be
need
the
to
goal.
see me or see a physician.
Oh, exactly. Like, you know, I'm thinking my daughter, her friends, she's very healthy. A lot of her friends are very sick. What is the difference? I was like OCD after her. Did you brush? Did you floss? Yes, mommy, let me check. And then they start laughing. They run away. They didn't brush or floss, my kids, right? So I said, okay, time for cleanup. I made it again. So they would not get cavities, you know, because you got to start when they're really young.
Yeah. I got a question too, because what we've been noticing too for all of the patients and the clients that come into the clinic, it don't be only them that are suffering from the same similarities of diseases. It's usually the whole family.
Their family.
And so, or they just swapping mouth bacteria.
Yes.
What's going on with that?
I am telling you. So there's a patient that called us recently. I saw him 20 years ago. So he comes, he has advanced periodontal disease. So we treat him very advanced. Of the person, I said, bring your wife because this is transmittable. So he brings the what? Advanced periodontal disease. I say, you guys are going to end up dead. You have children. Yes, an 8-year-old and a 10-year-old. Bring them.
Yeah,
I don't
bring
see
them.
kids,
Mhm.
but bring them.
Yeah.
Guess what? The gums are bleeding.
Yeah.
It's a disaster. I teach everybody, okay, this is a family reunion here.
Right.
This is what he's alive. He called me 20 years ago. And I said, listen, this is life or death. This is really important that you have to get it right. You have to go to the dentist every 3 months. We stabilize everything. The entire family. I said, go to your house. You're going to sterilize your house. Sinks, silverware, throw the pillows. That's all contaminated. New, wash everything, chlorine, and throw all the toothbrushes, everything you have in your bathroom. We're going to start from scratch. So we taught the father brought the mother, now the children. We saved one family. We got 500 million people to save.
So I got a question for you.
Yes.
What do you think about the ultraviolet light that you can put your toothbrush in?
Yeah, it works.
It works. Okay.
Yeah. Another thing is most people clench, so they have to use the mouth guard, you know, so that you should buy the little pot that has, you know, tablets and you put it, sterilizes it. So, you know, bacteria grow. So you have to sterilize it for a few minutes and dry it. And then you have it ready for the next night when you're ready to go to sleep.
One more question for you. I've been meaning to ask you too. I understand after you get surgery on your mouth done and you get the sutures in, you can't have any dairy products because of the overgrowth of bacteria.
Yes.
What about coconut? Because I know coconut ferments pretty quickly. Is it the same thing with that, or you can have the coconut?
We haven't seen that. You know, it's funny because we see it mostly on people that do dairy. And, you know, as you know, cow milk has mycotoxins.
Yes.
You know, when they do the cow, you know, and then the bacteria dies, and then the mycotoxins from that bacteria is what makes the milk so toxic. It's not the bacteria, it's the mycotoxins. You cannot get rid of it.
Yeah.
Even if they pasteurize whatever, you know, the process. So, you know, I follow a doctor from Switzerland. His name is Dr. Thomas Rau. They have done a lot of, you know, research about it's not, you know, that the milk is just the actual mycotoxins. So, for example, I like goat. Goat. Yeah, sheep.
Very alkaline milk.
Yeah.
Really, it actually is. I mean,
Yeah.
so I would call myself I would say vegan, but I like honey, Manuka honey. So I can't say vegan, but I don't do dairy or meat.
Honey
And
is so
it
antibacterial.
is alkaline. So this is my last question for you then. So people that have thrust and candida built up in their mouth on the
Yes.
tongue,
Yes.
would you or would you not recommend them to continue on like high sugar?
Yeah. So if you have mercury fillings, then you know that your body would produce yeast to protect your body not to have kidney,
So the yeast is kind of acting like a yeast biofilm.
like the parasites, right? So the parasites are the superheroes, the robbers that are not really robbing you. So the yeast, when you see somebody with yeast, is the body is producing a layer of protection. So it's like this infection that's so massive, it's not going to hit your organs.
So the yeast is acting as a
But
potential coating,
yes,
but in the long run causes more inflammation.
it's bad. It's not good, but it's a sign of there's a problem.
Yeah.
So we had a patient that he came with so much yeast that when we were working on a tooth, the yeast would come from the stomach like an eruption of champagne. We had 2 sections and we couldn't control. The yeast was so bad. Then we cleaned him up. We got the gum infection out, all the metals out. And then when he would come, that no longer was the case. And in 6 weeks, we got rid of that, but it took him 30 years to find us. And now the reason why he came was because the doctor said he's having some mental issues that nobody could help him. So she wanted to know, is there's metals in the mouth that's causing neurotoxicity? And the answer was yes.
Or just a simple systemic infection that done reached up there.
So he was like another person. And now the real job starts with you, with detoxification. We got the problem, but now the patient has to go for the things that are available to them, which is that everything is in your clinic.
Yeah, you got to detoxify. Detoxification equals regeneration in me. So
Exactly.
yeah, but and I'd like to tell people that like I'm not a healer. Your body heals itself. They have the natural capability of truly healing itself. You have to provide it the right environmental conditions, and that's what Doc do. And I'm here. I'm the plumber. I'm gonna come and I'm just gonna pull off.
That's right. So it's what we're trying to do is teach people lifestyle. Because then it has to become a lifestyle. Detoxification is something that should be daily. Like if I wake up, I do my beamer mat, I drink water with lemon, I do my beamer mat, then I do, a power plate, and then I do infrared, and then I do a bath with Epsom salt. Yeah. So I'm like activating, opening up, ionic bath. Yes. I had inflammation on my hand. And then I use ionic bath, get inflammation out. And there's so many things. There's some foods that are so good, like ashwagandha, right?
Ashwagandha is very, very, very good for you. Red clover is amazing. The flower buzz is real good to cleanse the blood. Burdock root, it brings in oxygen because it's full of iron phosphate. And then I like to tell people that don't have the money to just even buy all the equipment that we are fortunate to buy. Use the elements of nature. Ground out. Get up in the morning. When you get up, Go outside, take your shoes and your socks off and let all of those protons leave the body and let the earth give you all of those electrons. That'll help balance you out. Another thing is the lemon water, what she was talking about, is vitamin C in there and it's an alkalizer and it helps you digest and it moves things. Mm-hmm. And then you can intermittent fasting. Eat while the sun is at its highest in the sky and don't eat after the sun go down if you're trying to heal fast. Mm-hmm. So intermittent fasting is good too. They call it the 18-6 rule. You fast for 18 hours, you eat for 6. Mm-hmm. So it's so many things that God gave us to heal from. We just gotta, as a people, as a culture, as a nation, we just gotta really tap into them. So preventive maintenance. And don't forget to come see Doc. Yeah. Seriously. For sure. She changed my life. And, I've been so-called vegan for the longest, and I was wondering what my issue was and why I couldn't regulate and why I couldn't detox properly. And the whole time is I'm eating, I'm working out, I'm doing all of these things, but it was my teeth. It was my teeth. So, you have to check your mouth. The root cause is always in your mouth. And that's what from my experience, that's what I've been learning.
Yeah, thank you so much. You're very generous. I know you're very busy. So we're committed to spreading the word. So people don't have to suffer. Thank you.